In this morning's Health Watch, scientists have discovered a troubling pattern. The rate of breast cancer in a specific group of women is increasing faster than any other group. Elaine Quijano is here with details. That is something very troubling to hear.
It is something that scientists certainly weren't expecting. The reports are piling up. Young women of Asian American, Native Hawaiian, and Pacific Islander descent are increasingly at risk for breast cancer. And scientists are missing some key clues as to why.
How are you?
It was a personal college reunion, 18 years in the making. Regina Chincio Kwong and Canny Yulapak first met here at UCLA as freshmen. Now, decades later, they've both walked a path neither wanted to take.
You helped me so much and you don't even know it.
Oh, I'm so glad.
Yulapak was just 40 when she received life-changing news. What did the doctor tell you?
She told me, yeah, the results are in, and unfortunately you have breast cancer.
2 years later, Chincio Kwong's mammogram showed something suspicious.
I mean, what were your thoughts at that time when they said it's cancer?
I was in shock. I was expecting a completely normal mammogram. And then what I found was, wait a minute, Asians have a rising level of breast cancer. And so I was surprised that I missed that.
Good morning, everyone.
Even though she's a public health doctor, Chincio Kwong was unaware of a puzzling trend. A new report by the American Cancer Society found the rate of breast cancer among Asian American, Native Hawaiian, and Pacific Islander women under 50 is rising faster than in women from any other racial group. Asian Americans make up the fastest growing racial demographic in the U.S., but only 1% of medical research dollars have been spent on studying the health risks of the many ethnic populations within that group.
It has been a battle every step of the way.
Congresswoman Judy Chu represents California's 28th district, where 38% of her constituents are Asian American.
We need to disaggregate the data, meaning that it's so important to break down the different sub-ethnic groups that comprise our population to see what the differences are.
Without that information, what do you think the danger is?
Well, if we don't have that information, we don't know how to target the solution.
For Canny Yulapak, those solutions include more openness about health problems in Asian American households.
So did you talk about health issues growing up?
No, you only went to the doctor if you had to go to the doctor. So prevention was not something we ever even thought about.
But now she's trying to change that,
Hi, I'm Canny.
sharing her experience with other women.
Advocate for yourself when something feels off.
I couldn't believe that she had cancer and I didn't know it. And I was telling her, I have cancer. And I was just asking her, help me out, I'm going through this, you've been through it.
Both women were diagnosed early and are now cancer-free. They also share a new appreciation for the power of prevention and friendship.
The things that brought us back together was something you don't want anyone to have.
Right. Before having the diagnosis, I think I took a lot for granted. But then when you have cancer and you see the other side, you could hear noises you never heard. You could see colors you never saw, right? The world looks so much more beautiful. And you're hoping that you're going to be here forever to enjoy it.
So researchers are concerned this increase in the rate of cases could continue, but the encouraging news here is that breast cancer mortality rates continue to decrease, and they think that's because of largely the advances in screening, advances in early detection and treatment. So really the takeaway here, get those screenings. It's something that during the pandemic a lot of women let slide. And it's so easy to do in our busy lives, but just another reminder to get those screenings.
A moment of discomfort, but it is so
So critical.
So critical. Such an important story, Elaine.
Thanks.
Thank you so much. So great to see you.
Nice to see you.